the Nashville Bar Association Town Hall meeting on key considerations in designing a return to work plan. We're happy to have with us today 3 distinguished panelists, all of whom are managing partners in their Nashville offices of their law firms. We have Leila Hollabaugh, who's the managing partner of the Nashville office of Bradley, Charles Robert Bone, who is president and CEO of Bone McAllister Norton, and Mark Chalos, who is managing partner of the Nashville office of Leaf, Cabraser, Hyman, and Bernstein. Welcome, everyone. I'd like to get started by asking our panelists to tell us a little bit about how their offices have been operating since the pandemic really hit here in Nashville, or at least we knew that it hit in Nashville, and we started to operate under safer at home and other government orders. So let's start with you, Leila. Has your office been working from home thus far, and how's it been going?
We have been. We went remote in the middle of March. We went 100% remote, and it has worked amazingly well. I think all of us were pleasantly surprised that the technology worked as well as it did. And so it's really been fairly seamless. I mean, we've had a few minor hiccups, but we have everybody is capable of working at home. We certainly have had some people continue to come in the office on occasion, but it's really been very few. So we've been real pleased with how it's gone so far.
Charles Robert, has your firm been working from home, and what have been the challenges?
Yeah, that's a pretty similar experience. I mean, starting that third week of March, March 16th and 17th, we started preparing to get everybody transitioned to be able to work remotely. We had plans to have a lot of that capabilities later this year, so we expedited that pretty quickly over the first couple of weeks. But the remote transition, I think, has gone far smoother than we would have ever anticipated. Certainly has had its hiccups. So we really did 2 things. One is we identified kind of a core team of 6 to 8 people who would stay in the office, that would make sure mail was getting open, being distributed, that phones could be answered, that obviously checks were being deposited, 1 or 2 attorneys in the office, but really transitioned everybody to remote. We saw pretty quickly that the one thing a lot of people didn't have at home were printers and scanners, and so we figured out a way to deploy printers and scanners to everybody who needed that, which obviously was a big help. And I'd say the thing that hasn't worked, or the hardest part about it, I mean, I think from a technology standpoint, it has worked pretty well. From a productivity standpoint, I think it's gone better than I would have imagined. But we've created a culture here that is so dependent on connectivity and people walking the halls and talking to each other and having lunch together and having happy hour at the end of the day. And certainly some of that you can do through Zoom and over the phone, but that's been the hardest part about this. And I think that we'll have to balance kind of going forward as we continue to have people that want to work remotely. But we want to make sure we don't lose kind of that connectivity and the culture piece of it.
Mark, I understand your office is a smaller law firm here in Nashville, at least. How has work from home been going for you, and what have been the challenges for your firm?
Right. Well, in Nashville, we've got 6 lawyers and a total of about 22 people. We are fully remote in Nashville. We also have offices in New York and San Francisco. We have 254 people across the country, and everyone is remote. We have been very lucky in that our IT folks have, before the pandemic, really been cognizant of keeping abreast of the latest in technology and really updating our systems in a way that when we flipped the switch where everybody was remote, it was absolutely seamless. So, while it's sometimes hard to spend the money when you don't need it, we fortunately were pushed to do that. So it worked out very well. So we are fully remote at this point from top to bottom, and it's worked out fairly seamlessly. Charles Robert made some very good points about sort of the challenges. we initially thought the mail and the reception, taking phone calls live, were going to be really important issues. And we spent a lot of time wringing our hands and thinking about how to handle that. And it turns out it really isn't. There's not that much mail that's can't
or
be
not that
handled
much
another
important
way.
mail.
Yeah, exactly. We sent out in most or all of our cases a notice to opposing counsel and to any other stakeholders that we're not going to be in the office. So if you have to reach us, don't put a letter in the mail and expect that we're going to get it anytime soon. So as far as I know, we haven't missed anything important. One thing that I don't think we completely anticipated was we do continue to write more checks than I ever imagined that we would. So it turns out that we actually have had to figure out, to get somebody in the office periodically to write checks, and some checks had to be countersigned and what have you. We have transitioned a lot of that now to wiring, direct wiring to, the various vendors, banks, and what have you. But that turned out to be a little bit more cumbersome than I probably initially thought. But otherwise, it's been, fairly seamless. Everybody's at home, working well. As far as I can tell, the productivity hasn't suffered. In fact, in some respects, it's probably, people have been more productive. I think one of the challenges that, I don't want to get too far ahead of the program, but one of the challenges that we've been keenly aware of is that we have now transitioned to where people are living where they work, essentially. And I'm not sure that everybody is drawing the boundaries that they need to. In other words, the workday starts when you wake up and it goes into the time you go to bed at night. So we've been very encouraging of our folks to be mindful of that, to set boundaries, to decide when you're going to start working, decide when you're going to end working, and also to take vacation time, take your paid time off. I think some people are a little bit hesitant to do that because well, I'm at home, I'm not going anywhere. I'm not going to the beach. I feel like I'm sort of a little bit on vacation. So we've been very encouraging to people to, take your time, be mindful of drawing boundaries, give your brain a rest, give your worry a rest, take time to yourself, and be cognizant of that because, we may be in this for a little while longer.
We're now in phase 2 of the mayor's reopening of Nashville. And of course, across the state, we've seen a lifting of most counties' stay-at-home orders. I know for your firms, you're balancing critical safety and health issues with also your ongoing business needs. So my next question, and I'll ask Leila to chime in first, is has your firm set a date for reopening, and who are the decision makers? How are you going about deciding when and how to execute a reopening?
Well, we do. We have a return to the office task force. We don't call it a reopening because we've never been closed. So it's a return to the office, and we have a task force that has worked amazingly hard to develop protocols for all of our offices. We have a big footprint, and we have some cities that our offices, people will not be returning anytime soon because of the circumstances in that locale. But here in Nashville, we actually plan to start returning to the office on Monday, on June 1st. And that was the date that was set as the earliest return by our task force. And that task force consulted, we actually hired an epidemiologist out of UAB in Birmingham to consult with us on our return plan, to tell us what, independently the medical professional thought about it. And this helped us kind of develop our protocols as, the CDC is changing information really almost a daily basis as to what they know and think. And so that's a very core group of people. It's our chief executive officer, our head of HR, one of our partners, and a couple of other administrative people who've worked on that task force. They've consulted with all the office managing partners. They've consulted with key stakeholders throughout the law firm to see what works, what might not work. And we're learning, and it's definitely every email communication we have says all subject to change, always subject to change, because the knowledge is just, growing. And so actually Nashville and our Houston office are the only two that are starting a return on Monday. Everybody else is still a bit behind us. So we feel like a little bit of guinea pigs. We'll see what works, what doesn't work. But our initial return, we are phasing it similar to like what the mayor's done. Our initial return to the office is 100% voluntary. So nobody is being mandated to come back in. While we may have some staff that we will ask, they can say no. And we've made it clear that they can say no, that they're not comfortable coming in the office. And so I'm not expecting a lot of people on Monday, but we'll see.
That was going to be my follow-up question is, do you think people are going to come back? And I know that on top of that, people have children at home and summer camps that have been canceled. It'll be interesting to see how many show up.
Yeah, we did a survey just asking people to tell us what they thought. We had some that said, no, for health reasons, I can't come back. Some that said, I'm still nervous and I don't want to come back. Some that said, I'm happy to come back, but I really like working at home, so I don't plan to. And then some that said, no, I'm ready to get back in the office. So, and I think I don't think anybody wants to be in the office every day, 5 days a week right now. But we certainly will have some, I'm kind of optimistic that we'll have 40 or 50 people in the office on Monday, but that may be a high number.
Mark, your firm has offices in multiple states. What data sources are you consulting in formulating a return to the office plan?
Yeah, that's been a real challenge for us and probably for almost everybody. We have 3 different mayors, 3 different governors, 1 federal government, and we're hearing lots of different things from lots of different sources. So, that's been a real challenge for us to sort of figure out, who do we listen to? And we made a decision early on, and we also have formed sort of a de facto task force. It's the managing partners of the 3 offices. And we've also brought into that discussion the head of our HR, our IT group, and then our operations folks. So people who may not be sort of traditionally in the decision-making discussion, at least on the front end. We've brought them in because they've got valuable input here, and they have expertise that we as lawyers don't necessarily have. So we've been doing an every other day meeting on the phone with that group, and what we decided early on was really kind of 3 guiding principles. One is that we're going to listen to the science. We're really going to take a good look at what the experts are saying, and we're going to listen less to what the politicians are saying on all sides. Secondly, that our people's safety is really our paramount concern here. So long as we can, serve our clients, which we've been able to do, our team members' safety is really going to guide our decisions ultimately. And really the business of the law firm is secondary to that. Luckily, everything is lined up to where all those interests are sort of compatible at this point. So we haven't had to make any real difficult decisions in that regard. And third, we've decided we're not going to be on the cutting edge of returning to the office because it's been a fairly seamless, transition. People are working at home. One of the bigger surprises, I think, for a lot of folks in our firm is that the productivity across the board has not really diminished. In fact, as I mentioned, it may have increased some. I don't know that, I think we sort of had a notion that if people are home, they may not be working, and it turns out they are. And we're having, as I mentioned, sort of the opposite problem, which I think people are working a little too much. They're not clocking out, so to speak, mentally. So, that's sort of the way we've been guiding our decision making.
Mark's response gives the perfect segue to my question for you, Charles Robert. I know that you have multiple offices in different counties here in the state of Tennessee. How much are you relying on government sources and deciding when your office will return to the workplace?
Yeah, so we do have an office in Hendersonville, and they've been pretty quick to raise their hand and say, okay, that's nice. I know what you all are doing in Nashville, but can't we have a little more flexibility, which we've tried to provide. But our experiences are similar with the others in that we did a similar survey and it sounds like almost the exact same results from a lot of our folks. And so we've tried to do kind of what everybody is saying here, which is make this as voluntary as possible, give as much flexibility as we possibly can. We've not set a date to return to the office, either informally or formally. What we have tried to say to our folks is nobody's going to be surprised by anything they hear from us. It's not like they're going to get an email at 5 o'clock one afternoon expecting everybody to be back at 8 o'clock on Monday morning. If and when we do to formally reopen, to the extent that anybody is uncomfortable coming into the office, they will have that flexibility to stay at home. You mentioned earlier, obviously, we've got a lot of folks that are impacted by childcare needs with camps being closed, et cetera. And so we're going to create absolute flexibility around that. But obviously, as you said, with an office in a different county, not too dissimilar with them with offices in different states, we've tried to recognize that, provide them some flexibility, and say to our attorneys here that, like, if you think you need to be in the office for whatever reason, certainly we want to accommodate you. We're going to ask that you let us know the day before so that we can communicate with you if there's any issue, et cetera, and to make sure that we don't have too many people in the office. So ours has been very measured, very slow, and for the reason that Mark noted, that there's really no rush to come back since this has worked so well. And I mean, and we see the same kind of productivity results, at least in the short term. You know, like, I don't think this is sustainable forever, and everybody ends up in a silo and that they can't work together and collaborate together. But at least in the near term, and it's in large part, we've had phenomenal help and round-the-clock help from our administrative staff, from IT, from accounting, et cetera, which has really made all this possible. And thanks to their hard work, I think we've got the flexibility to continue to just ease this along.
I'm going to stay with you for a minute, Charles Robert, and ask, in your firm's planning for a return to the office, are you implementing any different protocols for clients and visitors coming to the office? And I guess part of that question would be, what are your current protocols?
Yeah, so a combination of both. One, we're like everybody, we're in a multi-tenanted building, so there's certain things that the building is doing and mandating, like 2 people in an elevator at any one time and social distancing, et cetera. What we're asking is that anybody that's coming into the office, whether attorney, staff, or otherwise, or client or otherwise, that you have a 5-question questionnaire. 2, we're going to take your temperature. 3, we're going to sign you in so that from a contact tracing standpoint, et cetera, if we realize at some point in time that we had a certain issue on a certain date, we know who was here. And then certainly if you're a client, you're going to go through that same protocol, but we're also going to come down to the lobby and kind of escort you up. I think all this, based on what you hear from the scientists and from the doctors, et cetera, is all prudent. And that's obviously our health and safety of our folks is first and foremost. But at the same time, even if this feels like a little bit of an overkill, we want our team to know that we're taking this serious, and that we very much recognize what's going on, and that we want them to know that we recognize that as well. So I think it's one part protecting health and safety of our team and clients and anybody coming into the office, but one part just an acknowledgement that we understand the circumstances that many people find themselves in.
Leela, I know you anticipate some people may return to the office starting on Monday. What planning have you done with regard to social distancing in the office?
Well, so we've done quite a bit. I mean, we've really walked and looked at our space. You feel like you know your space, but we really walked and looked at it, and we are actually in a really good position of how we're laid out, because if everybody is in their workstation, they are 6 feet at least away from the next closest person. The issues always become when you get on the elevator, or you walk to the halls, or you go to the restrooms. And so, of course, we are going to mandate people have masks on when they are unable to be socially distanced in the office. So, you just have to keep looking at the space and thinking about it. We've also made it clear to any of our staff who decide they want to come back into the office that if they feel like or for anybody, lawyer, staff, any person that's in the office, if they feel like their workstation is too close to somebody else for their own comfort, then we'll make adjustments and we'll move people around. You know, again, it's very flexible and fluid, and just like the others have said, you know, the safety is the most important. We're not in a rush. We're just trying to start to implement a voluntary process. And it's going to take a while. And I don't expect for us to be fully back in the office where we're saying, okay, people, you need to, you know, everybody needs to start coming to work for quite a bit longer. I don't know when it is, and we definitely haven't set a date for that, but we'll see how it goes.
Mark, can you talk a little bit about your plans, or at least what you're thinking about with regard to shared or common areas in the office, down to the refrigerator in the kitchen and the, you know, cups and mugs and plates that I'm sure you have in your cabinets?
Right. So we don't have a final plan on that, but our working plan is to probably close those areas initially, at least. I don't know what we're going to do about coffee. I guess you'll have to bring your own, but I picture walking through the office, everybody's sound asleep at their desk, you know, like the Far Side cartoon. But we're probably, you know, the common touch points are obviously the biggest concern. We, not intentionally, I don't think, ended up planning our space in a way, much like what Leela said, where people are already socially distant just by virtue of where their desks are, and most people have, you know, private offices. So, you know, we sort of inadvertently created a space where we don't have to make any structural changes within our space to keep people apart. But we do have the common areas. We have, you know, the kitchen is the primary common area. Our working plan is to just keep that off limits for now. We talked about different ways to, you know, try to minimize the contact, and we just haven't come up with a great plan to avoid, you know, having people interact with each other or, you know, touch the same things in that space. And, you know, in terms of the restrooms, you know, obviously that's a different situation. We are on a multi-tenant floor as well as being in a multi-tenant building. So the, you know, the elevator area and the restroom area is just inevitable. I think that people are going to have to, you know, be in a space that other people are using. So everyone's going to have to wear masks, you know, obviously wash their hands regularly. The building, we're lucky they're implementing some heightened cleaning protocols. So they are using some kind of chemical that they claim is safe and, you know, good for the environment, or at least not terrible for the environment. And they're going to do some additional cleanings throughout the day. And hopefully that will, you know, that along with our efforts and our co-tenants' efforts will minimize the risk of spread in those common areas. But that's good. That's good from a physical space standpoint. That's our biggest challenge right now is how to deal with that.
And hopefully their chemicals are safe, because otherwise I'm sure your firm will have something to say about it.
We might.
Charles Robert, what is your firm doing with regards to face masks now and also in the future for visitors, depositions, mediations, circumstances where people can't be socially distant?
So we have 1,000 face masks. We're loaded up on PPE, so to the extent that other folks need some help, we might be able to lend some of those out. I think the expectation would be that obviously when people are working in their office, there would be no need to wear a face mask as they come out into the halls and do some other things. Obviously, the expectation would be that they would wear a face mask, and we would have those available both for those that work here and for those visitors to the office. Obviously, we're known for hosting a lot of parties, a lot of receptions, a lot of big meetings here. I just don't see any of that happening, obviously, for the foreseeable future. And so I think from a face mask standpoint that we ought to be able to abide by that fairly well, both with respect to those coming into the office and those who are already here. Obviously, it will be a little bit of a change to see people walking up and down the hall with face masks, but certainly we will have those here with a strong expectation that people abide by that.
Leela, has Bradley been able to procure enough cleaning supplies, face masks? What have been the challenges and what has been the planning around that?
No, that's definitely a challenge. You know, we are requesting that our our people bring their own face masks. We have some, and we will have them available to the extent we have visitors, which is strongly discouraged at this point in time, any visitors on our space. To the extent that happens by necessity, we'll have some available, but we're really encouraging people to bring their own, which, is consistent with the mayor's directive to, be wearing your face mask when you're out. Cleaning supplies. We have staff who've been at the Publix and everywhere every day picking up supplies. But I think we have plenty to get started, and I'm optimistic given the CDC's change in their reporting that the virus is not primarily spread by touch points. I'm comforted by that because it just takes a little bit of stress off of all those touch points. We have heightened cleaning. The building, we'll be doing more cleaning in our space ourselves, plus having wipes and hand sanitizers and all that available. We have plenty of that, I think. But you're right, it has been a challenge because at one point, our suppliers were like, we cannot, they told us we can't get it for you. And so we've been creative. Our staff has been creative of making sure that we have enough.
Some of our judges in these town hall meetings have talked about erecting plexiglass barriers in different places in their courtroom. Have any of your firms considered putting up plexiglass at the reception desk or in other areas in your office?
Yeah, we have it at our reception desk. Mm-hmm.
You do have it? Is that what you said?
Yeah. Mm-hmm.
Okay.
Yeah, we do. We have implemented that.
Is that the only place where you've implemented it?
That's the only place I'm aware of right now. That's the only place where we really have people, a person, a receptionist who is there where might have contact with people coming in who don't have a face mask on yet. Visitors, to the extent we have those. Otherwise, everybody else should be able to socially distance or have their mask on, which is what we're encouraging.
We don't have it yet, but we have a big X on the floor as the closest that somebody can get to the receptionist desk.
That's good. Well, and that actually brings up another question I have. In terms of foot traffic in your offices for larger floor plans, have any of you thought about or already instituted like a one-way foot traffic pattern in the office?
No, we decided against that because we're encouraging people and really more than encouraging, asking them to wear their face masks when they're in the hallways, in the kitchen areas, in the bathroom. If they're where they cannot be 6 feet away, they need to have a mask on. And so, and the way our space is laid out, we really thought the directional signs, it would be difficult to follow them because you might be 2 feet from the bathroom, but if you had to follow a directional sign, you walk all the way around the big loop of the building. And then that's really more exposure to other people. That's not necessary.
All of our panelists have talked at one time or another about communicating with your landlord. Mark, tell us how your firm's coordinating with landlords and maybe even other tenants in the building. Has there been coordination or communication with them?
Yes, on both counts. So we've been in ongoing contact with our 3 landlords across the country, and discussing sort of what their plans were. They've asked us to do certain things. For example, they've asked us to stage our start times or work times, and they've asked for our input. Our building management, Hines is the company. They've asked us to give them some input on sort of what we would ask them to do and what we thought were sort of good ideas for them. And for example, we talked about whether they are going to check temperatures downstairs or whether that's going to be left to the individual tenants. And uniformly, they said, that's your problem, not ours. We're not going to get in that business. So, we've had ongoing discussions. I've also spoken with other tenants in our building, particularly the law firms that have, sort of similar issues to the ones that we have. And so it's an ongoing discussion. I think, at some point, most of the, discussion points end up with people going, I'm not really sure but we're going to do this and we'll see if it works. And if it doesn't, we'll try something different. So I don't know that anybody I've talked to, whether it's the building or other tenants, really has a hard and fast plan they're going to stick to no matter what. I think we're all sort of feeling our way through this and trying to figure out what makes the most sense for our folks.
Charles, Robert, I know you're well aware of the transit and traffic issues in the city of Nashville, which now appear to be under control. But Mark mentioned staggered work schedules. Is that something your firm is considering? And also just on a broader level, do you think that's something that we're going to see in the city and the state and across the country and that will inadvertently or indirectly help with transit concerns?
Yeah, who would have known that we would miss traffic, right? It is kind of refreshing today in the office. I can pull out of here at 5 o'clock and go straight through downtown, straight out West End, and it's quicker than getting on. I'm not sure I've been on the interstate in 6 weeks. But I do think just from a big picture perspective, that's a realization for a lot of people, which is, hey, how quick, and I think that impacts some people not wanting to come back to the office of how quick do you really want to dive back into this? And it's not just traffic, it's all the other commitments we make, right? I mean, I'm doing the same amount of work on half the amount of time because you're cutting out time in traffic, you're cutting out a lot of, maybe in hindsight, unnecessary meetings and things. Some things are easier to do by Zoom. But from a staggered work schedule, we'd already provided some folks that flexibility, certainly people that are coming in. We've got people that come in from Clarksville, from White House, from Murfreesboro, Smyrna, et cetera. So we had already tried to provide a little bit of that flexibility. I mean, it's just insane for somebody to have to sit in traffic for an hour, hour and a half. And so I assume not only will we get even more flexible and aggressive along those lines, and allowing people to work from home 1 or 2 days a week. But I think you'll see that, if not throughout the city, throughout the country, right? I mean, I think people have realized that maybe there is an easier way to do some of this. And again, we can't all, especially in our business, we can't all go remote 100% of the time. But I think staggering work schedules, both by day and then also, by week. I mean, not just the start of the time, but what you can do throughout the week. I think you'll see a market impact on that.
I want to take a brief pause just to let everyone who has joined the conference know that if you have a question for any of our panelists, if you'll use the Zoom group chat function to send your question across, I'll be sure to ask it to our panelists. Leila, I want to go back a little bit more to staff concerns and in particular travel policies. What things should firms be considering when implementing a policy being travel, personal business?
Well, I think we continue to look at that. We very early on implemented a policy that if you went on a cruise ship or traveled internationally, you had to report it to our HR, and then there would be a determination made about quarantine times. We still have those in place. We have directive not to undertake any unnecessary business travel. And right now, I don't think anybody thinks anything is necessary from a business travel perspective. We've asked people to report domestic travel voluntarily. And so if they go to a hot spot, they need to report that they've been to, say New York City. But right now, really nobody's been traveling, so I don't think it's been that big of an issue. We'll see as that picks up, whether we have to then consider whether we require quarantining if somebody's been in an area that's had an outbreak. Again, I think it's fluid. Just like Mark said, everything is fluid right now. We'll see how it progresses, and you have to make determinations on whether people can travel to certain locations. But like I said, fortunately right now, absent people going to a vacation home, and to the beach or to the lake where they've got another house, most people are not traveling.
Mark, is that the same with your firm?
Yeah, it is. We, in terms of business travel, we're down to basically zero business travel at this point. we're doing all of our hearings by telephone or by Zoom, and same with depositions and meetings. So for now, nobody's traveling, except for, there's been an exception here and there for extraordinary circumstances. At some point that will change, and I think we'll probably leave that to the lawyer's discretion on that. And basically, in terms of business travel, it's primarily lawyers. It's rare that other folks travel, but they do on occasion. But we'll probably leave that to the discretion of the lawyers at this point. In terms of personal travel, we have, as far as anecdotally, everything I've heard is everybody's staying home. Some people may have a second home somewhere, but otherwise, nobody's, planning to go to Disney World or anything like that anytime soon, or get on a cruise ship, or any of the sort of higher risk activities. At some point, inevitably people will do that. We don't yet have a policy in terms of, if you do that, you're going to have to quarantine. It's something we're going to keep in our minds. But for now, we are sort of relying on people to use their best judgment.
Charles, Robert, we're coming up on beach season, if we're not already in it at this point, because school's closed. How is your firm handling employee, not just lawyers, but staff members, personal vacation travel?
Yeah, so that question is timely. Would agree with them on, I see no work-related travel or international travel for anybody for the foreseeable future. But we do have people that are beginning to go to the beach. We have, myself included, family members who are beginning to go to the beach. And so as we originally kind of drafted up our phase 1 protocols, we had in there that anybody who went out of town, even if it was for vacation to the beach or otherwise, that we would expect them to come back and quarantine for a 14-day period. We ended up deleting that in part because Williamson County has a different policy than Davidson County. And so at the end of the day, Williamson County may not look a lot different than Alabama or Florida or wherever anybody else is going. And so then, where do we draw that line? So obviously we're asking people to communicate with us. Obviously, if they think they've been exposed or they've been to a hot spot, let's talk about it and let's stay at home for a reasonable amount of time. But we tried to avoid a situation where if somebody was going to travel to see family or go to the beach, that somehow they're now automatically quarantined for 14 days. That seemed a little overkill based on where we were, but obviously this is going to continue to come up throughout the summer, and we'll be able to watch it as we watch the data and begin to understand the severity of the issues, the severity of the risk, and if we need to do something that's stronger or more draconian, certainly we can, but for now we don't want to say to somebody they can't take a vacation.
Charles, Robert mentioned earlier in our discussion about questions that would be posed to visitors and clients of the office, temperature checks. And then he also mentioned having people sign in for contact tracing purposes. Mark, what things are you thinking about in your planning to return to the office for contact tracing?
Mm-hmm. Right. Well, Charles Robert laid out a great protocol that, is going to be similar to the one that we follow, which is if you're coming to our office, we need to know who you are and, when you're there. We haven't gone so far as to, get into people, where were you or where do you plan to go yet? And I hope we don't have to for lots of reasons. But in terms of who's in our actual physical spaces, right, we're gonna record that information for current and look back purposes for sure.
Leela, I don't know how many employees and lawyers you have in your office, but are you planning to do any sort of attendance sheets or sign-in sheets just for the employees in your office too, for contact tracing purposes?
I had not really thought about it from a contact tracing perspective, but we do have, and I just previewed it this morning, a calendar app where people will go in and say, I plan to be in the office for this day, these hours. And so when they complete that, we'll expect them to be in the office and not working remotely that day. But I think that can be used for contact tracing. What we have done to date is that if we have somebody who's positive, like me, you know, I said, these are the people I have been around, and then those people were asked to quarantine and stay home for 14 days. And obviously that, when I was diagnosed, was right when we went remote. We literally went remote the day after I got my positive test result back. So just having people self-report of our own people has been very successful for us, because they know who they were in contact with within the office, and then being able to ask those people to stay home has worked well. But I do think we are going to ask visitors to affirmatively, you know, state that they've not been around anybody with COVID in the past 14 days, that they have no symptoms within the past 14 days, and have them, you know, affirmatively sign a sheet when they come into our office stating that.
Since you brought it up, you have been in the news because you, of course, tested positive and then have donated plasma after the fact. But I am curious, once it became public knowledge that you had contracted the virus, how did you communicate that with clients of the firm and with other employees? How did you work on your messaging on that?
Well, from a messaging standpoint, we sent an internal communication to everybody in the office. Actually, everybody in the whole law firm received an internal confidential communication immediately that I had tested positive, so that they could assess for themselves whether they thought they had been around me. I think that that was incredibly well received internally. People were pleased to be able to know who it was, and you know, think, well, had I seen Leila, had I been around her? And several people did then go get tested because they thought, oh, gosh, I saw her yesterday and I spent some time with her, so I better go get tested. So I think that worked really well. You know, we did some communication to some clients, but it was general. It did not, I don't believe it identified me by name. It just said, we've had somebody test positive and here's where they were if you were around them. But that was unique to this specific circumstance. So I think that our internal communication has been really, really good about, you know, about me testing positive, and the firm support of it has been amazing.
Leila, thank you for being the guinea pig and multiple different scenarios for all of us. Mark, how is your firm thinking about handling a situation where there is some exposure in your office? Have you put into place any kind of plan or policies for communicating that to people who may have been exposed?
Yeah, I mean, we had a similar experience to Leila's, and right, we communicated that. Luckily, the people involved in our situation were not in the office. They had not been in the office at any time during when they were symptomatic or when they were diagnosed. So it made it easier in that respect. But right, we're looking at that going forward. You know, what happens, you know, if somebody does test positive. Now, let me back up. One of the things we're actively considering is having all of our employees tested before we return to work. And we've been in communication with our insurers, our health insurers, and asked if they would be interested in implementing that protocol. And their answer was, we're not paying for the tests if that's what you need. So we're going to end up probably having to do that ourselves. And we've been in touch with some private testing companies, but we're, you know, tentatively, and I don't know that it's necessary, but we're tentatively thinking that we're going to test everybody. And I don't mean the antibody test, but rather the, you know, active virus test before returning to work. That's at least our working plan.
Charles, Robert, I started this kind of topic by referencing the questions and the temperature checks that you are putting into place in your return to the office plan. Are you, similarly to Mark, considering having employees get tested before they return to the office, or I guess it could be or are you going to be doing daily temperature checks of your employees that are in the office?
Yeah, so we do plan to do daily temperature checks. We're doing that now so that when people show up, everybody's having their temperature taken. The first day mine was 92.9, so either the thermometer was wrong, or I'm dying of something else totally unrelated to COVID. So, but we are taking people's temperatures. We're at this point not going to require everybody gets screened or tested. Obviously, would reserve the right to do that. We've had a handful of people who have been tested, and everybody, including a result we got back this morning, came back negative. Obviously, we've got a plan in place that if somebody does come back positive and they have been in the office, what we're going to do. But for now, we do anticipate taking everybody's temperatures.
Let's jump ahead in time to when it does appear safe for a full return to the office. Are you considering allowing certain employees to continue to stay at home, whether it be because of health concerns or because of their age, or just because, like Leila said, some people just prefer to work at home? How are you thinking about those issues? And Leila, I'll throw that one to you.
Well, again, I think it's still fluid at this point. We certainly expect that we will have some employees that for health reasons are not able to come back to the office. And I think that will be an accommodation, just like you would accommodate any other physical limitation. Do your best to accommodate it. Whether we will in the future allow people just because they want to work at home. I think that remains to be seen. Certainly flexibility, now that we know we can do it. I think competition to keep quality people may require that. But I think that we haven't made any final decisions there. But I think we'll certainly consider it.
Charles Robert, how are you, or how is your firm communicating your new policies and procedures internally and externally?
More internally, I would say. So, I mean, obviously we've continued to have board meetings and attorneys meetings. So we've rolled that out via Zoom meetings, also rolled it out by email. And then obviously the core team that's still here in place is, in charge of enforcing that. So we've not seen the need to communicate that to clients or, throughout our contacts, in part because we've got very few that are planning to come to the office for anything. Obviously, we've got signage up. The building has signage. Then we've got specific signage when you get to our floor. We've also taken measures to take chairs out of the conference rooms, put up a occupancy limit for every room now, et cetera. But I hope our attorneys and staff would say we've done a good job of communicating not just what we're doing internally, but why we're doing it and how we've gotten to where we are. Again, we don't want anybody surprised. We want people to feel like, we're taking their safety seriously and to give them the flexibility around that.
Mark, how is this pandemic forcing law firms to think differently about their future?
Well, law firms only really do things when they're forced, it seems, in terms of innovation. I think that we have been sort of toying around with this idea of, do you really need to be in person for everything? Do you have to do your depositions in person? Do you have to do your hearings in person? Do you have to do your meetings in person? And, I think everybody says, yeah, we should think about doing more things remotely. It saves us time on airplanes and wear and tear and expense. But I think, in the back of everybody's mind, they go, it's probably better to be there in person, if you can be. Lawyers are stubborn and very conservative in that respect. So I think we're going to see some people move off of that a little bit. I think, we've seen that we can do hearings. We can do, particularly the hearings that may not be as substantive as, some other types of hearings. They can be done on Zoom. They can be done telephonically, and the world doesn't end. The case still moves along. Some depositions can be done just as well on Zoom as they can in person. Not all, and I don't know that it'll ever be my preference to do a deposition by Zoom, but that's just a personal preference. So I think we might see some of that stick long beyond this. I think what it also, on the flip side, what this has underscored for us is that there is such a tremendous value to, the human contact and the human interaction that, everybody's missing, I think. Maybe there's some people that don't miss it, but I think most people miss it. And we can function as a law firm with everybody sitting in their homes, and we can continue to serve our clients and continue to run the business, but we're missing a lot by doing that. And I don't think it's sustainable, as Charles Robert mentioned, forever. I don't think that this is the way anybody really wants to practice law for the rest of our careers. So, and it's really underscored that, we need to have that human contact. We need to have the ability to walk into each other's offices. We need to, see each other and laugh and tell stories and share each other's, joys and pains and whatever else happens through the course of the day. So I don't think we're going to see wholesale changes to remote work. We'll probably see more remote work. We'll probably see more remote gatherings from people around the country. But I hope and I think we're going to return to, at the right time, a more human interaction.
Charles Robert, how has this unusual situation started already factoring into future plans for your firm?
Yes, similar. I mean, we were in the process of completing a space plan and signing a new lease. Probably would have happened the day we went remote. So we put a little bit of a pause on that. 3 weeks in, I had some of our lawyers saying, "Oh, we don't need the office space that we thought we did." And obviously, what I said at that time is, we're not going to draw any hard conclusions based on 3 weeks of working remotely. I think 3 months may tell us a little more. But similar to what Mark said, I mean, I think there are some things that obviously can be done remotely. Nonprofit board meetings, instead of driving halfway across town on an afternoon or a morning and killing 2.5 hours for an hour meeting, some things like that, where there's a lot more efficiencies. We've been a part of a mediation that we've had 3 different sessions with clients in Canada and folks that are here. And just far more efficient than, and as Mark says, I mean, obviously there are some things you do where it'd be helpful to be able to sit across the table from somebody to close a deal or to close a settlement. But I do think it will allow us to think about things a little more differently. I've got friends, obviously, that are outside of the legal profession, that are in sales and that do a tremendous amount of travel all week, every week, and had no idea what it was like to be home and to be with their kids during the week. And so I could see all this returning to normal over a period of a couple of years, but I think people will be really slow to do that. We've got some attorneys that are saying, "Hey, listen," and we already provided people a lot of flexibility anyway. It's not like we're, check and call and roll here at 8 o'clock in the morning and 5 o'clock in the afternoon. We tried to provide our folks a lot of flexibility of that on the front end. But now I've got people saying, "Well, I don't want to work remotely all the time, but maybe I could on Fridays, and maybe I could on Fridays during the summer, or maybe I could on Mondays, et cetera." So I think you'll see people kind of adapt to a little bit of a new rhythm. And some of the things that maybe we had taken for granted beforehand, we won't be so quick to give back up and kind of ease things along for a while.
Leila, let's talk about technology for a minute. I know, having talked to lots of different lawyers over this time, that some firms were better equipped than others, technologically speaking, to have staff go to a work from home scenario. I think largely firms already had lawyers that had that ability because we never stop working. But what things are you thinking about for Bradley for the future when you make your next purchases of computers and other technology?
I think right now we're really focused on adding a lot of laptop capacity and really switching out. We have a lot of lawyers who have the laptops that I don't have one, so I'm not sure I can describe it, but that apparently hook into become your desktop, and then you take them home, and really making it so everybody's got that capability. So instead, like working remotely, I work off my Mac Air and log into the office remotely, but a lot of people have a laptop that they can just plop it on their desk at home. So making that more available to all of our attorneys. And then we've also been able to give all of our staff laptops so that they can do their job from home to the extent they needed that and weren't able to remote in, using our Citrix, which is the program we use to access the office remotely. But, you know, again, our IT people have been amazing through this, and how quickly we were able to get everybody up and running remotely was just phenomenal. It's like I said, you know, we went from Sunday, which I think was March 13th, and everybody was remote on March 14th. And maybe a few people, you know, it rolled out really just in a couple of days. So, but the laptops, I think, are the primary focus right now. Everything else seems to be running fine. I haven't used a printer in 2.5 months. So, you know, I've got one sitting in my home office, but I've not printed anything. It's amazing. I'm saving all kinds of trees.
We're coming to the end of our time, so I want my last question to actually be a question to all three panelists. What has your firm done, either before this pandemic or during it, that has made you most proud? Mark, we'll start with you.
From a business standpoint, what I'm most proud is that we haven't laid anybody off. We haven't cut anybody's hours. We haven't furloughed anybody. And, you know, at our own expense, we've done that. There are some employees that are working at home who probably don't have a lot to do at home just by the virtue of the job that they did. So I'm very proud that my partners have, you know, decided that early on, and we've done that. So I'm very proud of that. I'm also really proud of the way our teams have pulled together. We do a weekly Zoom meeting on Friday afternoons, and I make it a point, we talk business for 2 minutes, and that's it. And then the rest of, you know, we spend usually 45 minutes or an hour. We just talk about, you know, what people are watching on Netflix, or people show their dogs or their kids or, you know, their cats or whatever it is. And we just goof around for an hour, basically. You know, I'm learning how to juggle. I'm going to debut that, I think, maybe this afternoon. And it's been great. You know, I've learned things about people who, you know, I've worked with for years, and, you know, that's been a really positive, you know, sort of unintended consequence here, is that, you know, we've been able to pull together and really, you know, find a human connection through, you know, very challenging time and through very challenging means, you know, doing it on a Zoom call, but it's worked, you know, it's worked out well, I think, for most people. And I'm very proud of everybody for really putting the effort in to do that.
Charles, Robert?
Yes, similar. I mean, we very early on announced to everybody that everybody's going to keep their jobs. We weren't going to cut. We'd go as long as we could, would not furlough anybody, would not cut pay. We wanted people to have that assurance that would be the last path we would take. And we've tried really hard over the last 15 years to assemble a group of people that really likes each other and that likes working together, that likes being together, that likes eating lunch together or having a drink in the afternoons. And so we've tried hard to maintain that and really give our team here a lot of credit. They started putting together care packages to send to everybody and have delivered to everybody, attorneys and staff, just so they know that we're thinking about them, that we care about them. We've got a team here who is proactively thinking about people who live by themselves and that are just proactive, not because I ask or anybody else asks, that are just proactively reaching out to check in on people and see how they're doing. And I really think as a result of that when we get to the other side of that, we'll be stronger as a firm and stronger from a culture standpoint, because everybody knew that we were sticking together and that this was about something more than just the bottom line, and something more than just about a comp plan. Obviously, I'm having to still bang the drum about hours and getting your time in and collections, et cetera. But I think people realize that this is more than that. The business is a piece of it, but this is more than just a business as well.
And Leila?
You know, just like what each of them have said, you know, just being proud of how our people take care of each other. That's just been great, whether it's picking up the phone, you know, getting on a Zoom call or a WebEx, whatever it is, just to touch base and check in on people, just to see how they're doing. I mean, for a lot of people, this has been, I think really, I would say everybody, it has been stressful. It's been emotionally stressful, draining. And And so just checking in on everybody's mental health and just saying, are you okay? Is everything okay? What can you, if you need something, let us know. And that just showing that you care about the person. And I feel like we always do that. But in this time, I think everybody is kind of going that extra mile just to really check in on people and say, hey, are you okay? And that makes me proud. And it makes me, I do want to say this before we get off, because I know we're out of time, that how much Laura Baker and Monica Mackey have stepped up and led this bar association is something that every one of us should be so proud of. So as we're talking about things we're proud of, you all have done an amazing job of leading us through this. And we just are so fortunate to have you two at the helm during this pandemic, even though it was not what either one of you signed up to do. So thank you.
Well said.
Well, thank you. I promise I didn't pay Leela to say that. That wasn't part of the script. Thank you, Leela. I appreciate that. And thank you, Mark and Charles, Robert, and Leela, all for making yourselves available and sharing all of your experiences and thoughts with us today. This will bring our town hall meeting to a close, and we hope everyone stays safe and well.
Thank you.
Thanks, everybody.
Thanks.